Saiu, né? No.
Feliz. Pronto.
Hey, Renata, it's good to see you.
Yeah, good to see you too. Very nice. Hello, everyone. Thank you. It's a pleasure to meet you all.
Same here.
Hello, Renata.
Hello.
Marcelo, I think we can start. There is only Renata that will join us briefly. So, thanks everyone for being.
No, Renata is here already.
No, there is Renata.
There's another one.
Ah.
Yes. One more, Renata. So thanks everyone for being with us today at the Health Innova Global Summit. This is our panel in English, so we can connect with different ecosystems and health techs all over the world. I hope you connect with us. We have many groups at LinkedIn, HIHUB.TECH, and we are a digital health innovation hub. So we expect to meet you and to engage with all the people that will be viewing this video and panel. So I invite Marcelo Lencin, CEO and founder of Shift, who will be the moderator today. Thank you, Marcelo.
Well, good afternoon. Thank you, Sembranelli. I'd like to thank you and HIHUB for bringing together the community and to discuss, promote, and develop innovation in health. I also would like to welcome and thank the guest speakers of this session. It is an honor for me to be the moderator, and I will do my best for us to explore the subject and capture at least part of the experience and knowledge of you all. Thank you for the opportunity. We know that the globe is more accessible and the physical and geographical frontiers have been, well, at least for the most part, diminished, especially when we discuss digital solutions. But although we have this global access and the desire for entrepreneurs to expand their businesses, there are many challenges in this journey. Healthcare is a main theme around the globe, and it has been intensified after COVID-19. The economic forum in Davos is taking place this week, and one of the themes is global health. As its main theme is history is as a turning point time. It provokes us to solve global issues, and technology can definitely have an important role during this turning point. Well, this brings us to our session topic, which is internationalization of HealthTechs, challenges and opportunities. So thank you all. I would like to start with Ana Carolina, because we only have like an hour and 10 minutes. I would like to combine the self-presentation with the first question. I think this will give us a dynamic that will save us time. So please, before answering the question, Ana, could you please introduce yourself, tell me a little bit about your company and your background, and then try to touch the first question, okay? Looking at the biomechanical history, it's possible to note that the internationalization was an important and significant fact that took place in 2014 with the cooperation between Brazil and Switzerland. Although this was very significant, we cannot underestimate the excellent work before that was done by the Pengo family in Brazil that certainly enabled this successful international operation. So after introduction, I would like you to touch this. We know that the internationalization is a broad process, and good products and people are the foundation for such efforts. But at the same time, government, corporations, international programs, events like this we're living today here, M&A process could also play an important role. How was for Biomechanica? A solo career, or did it count with any international or government program or any special activity that led into this process? Could you please share how was Biomedica's journey into a global experience?
Oh, the sound.
We don't
I'm
have your sound.
sorry. Yeah, do you have now?
Yep.
Okay, all right.
Yeah.
Okay, so thank you, Fernando, for the invitation. Thank you, Marcelo, for the introduction. So it's a pleasure to be with all of you. I'm talking from Switzerland today, so I'm living here since 1 year, and I'm living this amazing experience to make a family company international. It's a big, big challenge. It's not a dream. It's not a novel. It's more about to really wish to do something big. And it's a story with a lot of knowledge, new knowledge, to do networking, and also the language is still a big challenge for me. I don't speak French, so I'm living in a country where I don't speak the language. Anyway, let's go. Biomechanica is a family of it's a company of my family, and my father started the company 35 years ago, doing some orthopedic implants. Since the beginning, we were supplying the public health system with a lot of different products. We have a big portfolio with around 5,000 different items. But I would say the DNA of our company, we are an industry, but our DNA was always to do R&D. And Brazil is a little bit complicated to find a nice resource to do it. So my father developed a patent for an innovative product mixing medical devices and technology, like a chip to do the monitorization of the implants inside the body. So it's a really high technology product. And on that time, it was in 2014, the Swiss government, they use it to have, I don't think they have anymore, but they use it to have a big team looking around Brazil to find innovative companies and try to attract them to go to Switzerland. And we were invited by the government to come here to visit the country. It was my first time in Switzerland. I had the opportunity to visit some hospitals, some universities, and to discover this amazing innovation network. So the government at that time, and this is really key, the government helped us to come to Switzerland. So their whole, through this internationalization process is mandatory, was mandatory for us, because they helped us not just with money, because they invested in our company, but also with networking and to find the right way to open a company in Switzerland, which is completely different if you compare how to open a company in Brazil. So, and why we chose Switzerland and why the government is so important, we could discover through the years here that the innovation process is really a big networking process, and to know the right way to do the innovation. So here in Switzerland, we have around, it's incredible, 1.130 billion of reais to invest in innovation. So the government is putting this money inside the companies, and you don't need to give this money back. So the government's helping us not just to open office, to find people to work, but also to know how to have access of this money, how to have access about, the big innovation centers we have here. For example, Switzerland Innovation, they have 5 different places. It's like a hub where they do innovation for industries, and they have 45 different knowledge areas inside their buildings. It's incredible. They have industries inside the building just to do R&D, to help the companies, not just to do innovation, but also to develop the process. It's incredible, really. So the government was and is, until today, a key partner of our company here in Switzerland.
Well, thank you, Anna. We see how it's important to have programs to incentivize companies to grow and develop R&D and be able to be global and really solve global problems. So I think this is a very key thing that we have to provoke in many countries, and especially in Brazil, who is trying to fit into that scenario. Well, thank you for your contribution, Anna, so far. I'm not sure if Renata Robart is here. I don't think she got here, right, Fernando?
Hi, guys.
Oh,
That's
she's
me.
here.
Yeah,
Oh, okay.
her name.
I'm ID'd as Marcelo Greco, but this is me.
Everybody in
Yeah.
the beginning was Greco, so I think I don't know, he's trying to get all over. But anyway,
Thank you.
thank you for joining us.
Glad to be here.
And well, thank you. You have been supporting Brazilian companies in their internationalization and helping also international players to enter the Brazilian market. We know how important this is as an enabler to explore and expand broader businesses opportunities. This step can be very complex, and regulations could also maybe sometimes dictate one's strategy towards a specific market. Recently, for instance, our regulatory agency Anvisa published a norm called RDC 657, which regulates about software as a medical device. In what ways, in your opinion, this impacts entries in Brazil? Is this regulation aligned with international organizations? In your opinion, will this maybe, on the contrary, facilitate this exchange and, let's say, this path open for two ways?
Thank you, Marcelo. Good afternoon, good morning, or good evening to everyone listening to us today. As you mentioned, I'm a lawyer, so I'm very much used to assisting clients, especially foreign clients and local clients from Brazil, in the structure of their business regulatory-wise. When it comes to local clients trying to explore a different territory other than Brazil, we usually work with local law firms that actually understand the regulatory framework and can enable their entry into this market, because, as you know, health in Brazil is complicated, but it's not something that is limited to our country. So each and every country that performs health regulated services will have their own frameworks, their own requirements, and so on. So we usually help both sides, either the client coming to Brazil, and then in this case we can assist clients in understanding and evaluating what are the specifications that are required to perform activities in Brazil. So if you want to, for instance, manufacture or develop a software as a medical device, as you mentioned, you are required to have and actually hold specific licenses for that matter. And in this case, we even have an issue still with our Brazilian health regulatory agency, that many other regulations, in addition to the one that you have mentioned, must be updated to reflect the reality and reflect requirements that are consistent with the reality of software as a medical device. And on the other hand, if a local company wants to explore that a different territory, we usually indicate other law firms that are fully have the full knowledge to assist them in how that system works and what are the licenses required, marketing authorizations, if there are any specifications depending on the activity that is going to be performed, either a service or a product. So usually this is our role here. in terms of regulatory assistance, but we also, of course, always assist clients on contractual matters, either in investment, either in a marketing, in a M&A or any kind of collaboration agreement. We are also very used to assisting clients for that matter, especially if it's regulated from a Brazilian perspective. So this is pretty much what we do and how we assist clients in these foreign interactions. Focusing on your point on the new resolution issued by Anvisa on software as a medical device, my opinion is yes, that this regulation is very consistent with other regulations being issued on the same subject. It seems that Anvisa made a very good job evaluating other regions, how this was being regulated by their fellow agencies, for instance, the FDA or the Canadian agency, the Australian agency, and so on. And Anvisa also focused on developing a new regulatory framework that was pretty much consistent with the guidelines that were provided by the International Medical Device Regulators Forum, which is an international forum that congregates many other sanitary agencies around the world, and that they are thinking the same way in terms of, okay, this kind of product is clearly health regulated because it impacts on how people are going to get healthcare assistance, either it's prevention, diagnosis, treatment, rehabilitation, and so forth. They have the specification of being a software, while most of regulatory agencies are used with hardware kinds of regulations for drugs or for medical device for that matter. They also identified that these entities, they have a different profile in terms of who is developing these initiatives. So these agencies were very used to interacting with duly licensed companies that were born and raised to perform and to provide health regulated products, whereas now we have a tech company that develops hundreds of services and somewhere in between desires to develop a software as a medical device that can help patients to diagnose a disease or to treat a chronic condition. So they gathered all of these characteristics, I would say, that are being recognized in this new reality of software as a medical device, and tried to create something that was consistent with this. Of course, as I mentioned it, there are at least 3 or 4 regulations that Anvisa, in my opinion, would have to take a look at to update or to create a new regulation to make the regulatory framework consistent with the reality of software as a medical device. But for sure, this was a huge step for Anvisa and for reflecting and making Brazil more reliance in terms of regulation on that matter, with many other countries that already regulated this subject.
Well, thank you, Renata. It's good to know that Brazil did its homework.
Right?
And
yeah.
And this to be compliant with this regulation will open the ways for entrepreneurs in Brazil, and making this a two-way back and forth, which is very good. I think we have a long journey to go, but it's good to know that we're doing the right thing. Thank you.
Yeah, thanks.
Well, let's go now with Salvador. Well, thank you, Salvador, for being with us. And we know that another important challenge for internationalization is the cultural aspects, and where the business will be expanded, not only for addressing the market, but also the cultural differences, for instance, among teams, if they work together, and usually they do. You have an operation in California with solutions for patient safety. From the cultural aspects, what were the challenges and opportunities faced by Safe4Me and its operation in California? Any interesting story that could be shared to enlighten this important aspect of taking the businesses overseas?
Hi guys, hi everybody. Thanks Marcelo for the kind, for your questions, and thanks Fernando for this kind invitation. So little bit about my background. I'm a physician. I was graduated on South Brazil, the Catholic University in 1896. I used to be a surgeon. I'm not a surgeon anymore. It's been a while since the last time I performed the surgery. So the thing is that I've been, working as a executive, a healthcare executive for the last 15 years. And I had a chance to be what we call here in America, the CMO assistants, or the someone who helps the CMO. So I started working with legislation and administrative level at my hospital in Brazil. And on 2013, we had a huge shift in the Brazilian law, because we had the Ministry of Health launched the Brazilian policy for patient safety. And, it was really interesting because this is brand new. And for those who were not, very used to the topic, more than 200,000 people die in America every year due to medical errors. Medical errors are the third leading cause of death, not just in the United States, but in Brazil too. Maybe it's the second leading cause of death in Brazil. And after COVID, things get really worse. So it's a huge problem. Imagine that, you're a healthcare professional. You're not leaving your home today to hurt someone. No, you don't do that. But that's true. We do that on a daily basis. For sure, we don't want to do that. But that's how it works, because we don't recognize our industry as a risk industry for everybody. So we have to change this mindset. We have to compare ourselves like the aviation did on the back on the 70s, and really change the process to try to rebuild our market. So I've been dedicating my time to do that, and I have a huge dream, like my moonshot. Less than 30% of the public, the average public, knows that they have some risk when they get in a hospital. So we really have to change this medical literacy, and everybody have to be aware that there's a risk when you go to a hospital. And that's what we do at Safety for Me. We try to create content, create review systems and all sorts of tools to try to help people to understand that, the healthcare is a risk industry. So that's what we do. And we're getting some traction in Brazil. We're doing great. We have 17 clients over there. And back on 2019, I decided to come to the United States, to San Diego, to do a postdoc and to try to validate my platform for the American market. So going straight to your question, I think one of the big mistakes that an entrepreneur can make is to think their solution is just copy and paste. This is a big mistake, because the cultural gap and the difference are huge. If you compare the end users, I'm talking about patients and family and friends, it's completely different. The level of medical literacy here in America is completely different. People know much more about liability and safety issues in America is a big thing. So we are just learning in Brazil, so we can be more, we can give more basic information in Brazil. Right here in America, you have to be very much more sophisticated when you introduce this topic for the general public. So this is one of the things. The other thing is when you talk with the healthcare executives, it's completely different, because they are really worried about being sued. The legal issues, as I said, liability here is a huge problem. You know how much costs insurance for a healthcare professional to work? There's a famous case that is going on the social media. I think you guys are following, about the nurse who was, he was, how can I say that? He was convicted to, murder someone because she just made a mistake with some medication, and she assumed her problem, and she assumed that. So this is a big problem here in America. So this is one of the cultural things that we have to learn for. Well, the second thing is about the business model. In Brazil, we have a B2B model. So our data, health insurance are very interested on our data. Hospitals are very interested on our data. But right here in America, because there's so many platforms and solutions and applications and stuff, so you can get in a hospital as a regular vendor and say, hi guys, I have some data to offer to you, and they will say, man, I'm full of data. We're overloaded. Get out of here. We don't want to talk to you. So I kind of have to, discover a different way to get in the market. And here we're offering our solution as a donation. So, the individuals here in the United States, they donate a lot. So we are offering them to donate. They support with money the platform, and we offer the platform for hospitals and health insurance with money. So at the end of the day, they are not paying to have the platform. They are receiving money to have the platform. So we changed completely the business model to get in the system. So that's a big thing. And the third thing, Renata just mentioned is it's the legal thing. It's oh my God, this is huge. When you talk about in the United States, you talk about the Medicare regulations, the CMS regulation, the HIPAA compliance, and and the tax system is crazy. If you live in California like I do, it's just man, this is the first year I'm paying tax here, so I'm getting nuts. It's and you know what? There's another problem. If you are a partner of the company and you live in Brazil, and you have a company in the United States, it will change the way you pay taxes in Brazil too. So it's a huge impact. So it's a long journey, my friends. I'm telling you, it's quite hard, and I'll be very open to discuss any of these topics with you further. Sorry if I take too much time, but it's a lot of things to talk about it. Yeah.
Yeah, it's great. It's great to hear all those stories because they can inspire us and make us, think about it, those opportunities. But they're really challenging. Yeah. And as you said, well, in the US, it's a different world, right? Especially in data and numbers and opportunities. I mean. Changing the business model like you did, it's quite an opportunity that probably I would guess that the only country that would be possible to do this is in the US, if I'm not mistaken, the way you did.
Yes, for sure is the biggest opportunity in the world, the biggest country in the world that you can have this opportunity. But I'm telling you, it's hard. It's not easy, man.
I know. Well, congratulations.
Thank you.
Well, let's go for this. The other Renata who is joining us here from HIHUB. So thank you, Renata, for being with us. And your startup, HIHUB, presents itself as a first personal assistant for sleeping, offering digital therapy and monitoring. We know that how insomnia could affect our personal health, well, and other sleeping disorders. To create innovative solutions to solve global problems it is very exciting because all of us here have in some way doing this. But at the same time, we know that to be able to deliver those solutions in the market is not a simple task, either local market or global markets, especially when we think about different solutions that has to break the way we do certain things. In Brazil and many other countries, in other parts of the world, the sleeping problem is not widely treated or part of the health strategy in many ways. How do you see these opportunities and challenges to like a go-to-market strategy for those innovations, both for domestics and global markets, because it's an educational process?
So thank you, Marcelo. Thank you, and Fernando, for the invitation. It's a pleasure to be here. Yes, and there are a lot of opportunities, but a lot of challenges as well. So I'm Renata. I'm co-founder and CEO of HealthTechs. And yes, HealthTechs is a platform for digital therapeutics for sleep disorder, and special insomnia. So we are a medical software, and we focus on evidence-based outcomes, on clinical outcomes, and that's what we do. And HealthTechs was born actually to democratize and provide access to the insomnia treatment. So we have around 20% of the population with chronic insomnia. So there is a very high subnotification of insomnia, and we have very few professionals. There is a real lack of treatment, and the people that manage to get a treatment, they start using sleep pills, and then they get addicted. It's not efficient. It's not. They get tolerance and dependence. So HealthTech was born to help with this accessibility and to help people stop taking pills. So that's our purpose. And it's a challenge. Definitely, the go-to-market is a challenge. It's a market that's quite new, not only in Brazil, but in US, in Europe as well. It's intrinsically related to regulatory approval, mainly the prescription digital therapeutics. HealthTech is an over-the-counter digital therapeutics, but we do need regulatory approval. So we have it in Brazil. At the moment, we are doing our American FDA and CE mark in Europe. And that's because HealthTech was born to be global. We have a global mindset. Our B2B market, our go-to-market approach is Brazil. So we are, let's say, we have this Latin culture, NDA, and but we are preparing ourselves to be global. We treat a global problem. It's not just in Brazil, and people keep asking us for the product. Our customers in Brazil, our multinational customers, they want to take us to other countries. So we prepare ourselves for that. Since the beginning, we protected our trademarks worldwide in the main countries. So we're filing our intellectual property to be international as well. So yeah, and the go-to-market that we look for in Brazil, what we see abroad is mainly by reimbursement, mainly the prescription digital therapeutics through healthcare insurance providers. We do have insurance providers in Brazil as customers, but not via reimbursement at the moment. I believe we'll be able to do it in the near future. But in Brazil, we focus on marketplaces as well, on over-the-counter at pharmacies. So we're starting to sell HealthTech at a drugstore. And yeah, that's the go-to-market that we are using in Brazil, but each country has its own specific conditions. It's sometimes, for example, a medication benefit plan is another way of monetizing with the digital therapeutics. But the most important thing is, in my opinion, is to make it accessible to people. People need it. People are desperately looking for something that will definitely treat the insomnia problem. So that, and these people that we want to reach. So yeah, I think that I covered everything. I don't know if it's Marcelo, any other point that you wanted to?
No, thank you, Renata. I've seen so many great solutions like HealthTech, trying to solve, health problems and trying to work in global issues, but many times, sometimes we have to educate the market.
Yes.
Because sometimes people don't know that they have the problem. The problem is not treated. The problem is not. There's no awareness and into that specific solution. So you have to educate the market first before you can really sell it. So this is very challenging. I have seen this over and over, and some entrepreneurs, they get tired of this. How about you?
Yes, actually. Well, nobody knows about sleep. Well, the doctors, they don't learn about sleep at medical school. The children don't learn about sleep at school. The healthcare insurance providers, they don't know about sleep. Nobody knows about sleep. Now, after the pandemic, people are getting, I think the awareness of insomnia or sleep disorder is getting a little bit higher. But yes, there is a need of education. We have a huge challenge with doctors. Unfortunately, the doctors, they do not know that for example, the cognitive behavioral therapy is the most effective therapy for insomnia. They don't know that. And that's because nobody knows. We have less than 30 sleep psychologists in Brazil, and that's the same in the other countries. So there is a huge need of education for the doctors, for the family doctors, for all the clinicians to learn to be able to treat insomnia and sleep and somehow help with sleep hygiene and etc. Because we have half of the population with the sleep problem. So, and in terms of the patient, the end user, it is another challenge, I guess, even more in Brazil, because in US, in Europe, people somehow they look for a digital health solution in the Play Store, for example. They are more educated about it. In Brazil, no, there is no awareness about this. It's changing a little bit because of the pandemic. People started to look for digital health solutions. We tend to see that consumerization of health, of decentralization of health, personalization of health. So, for example, today one of our biggest customer is actually the telecom industry, it's Claro, the telecom, and that's because we see these huge marketplaces, these huge companies worried about the health of the population. So they started to offer healthcare services to the population. So, and this is one of the channels we use to massify the access to everybody. So, yeah.
Well, thank you. Thank you so
you.
much. Well, continuing our round, we're going to go to Philadelphia right now, right? I think Greg is in Philadelphia. I think I've heard that from Fernando. So thank you, Greg, for being here with us. And Kazana Health in the US uses technology to transform mental health care through monitoring and support for behavior change, which is a big problem and a big challenge, which is great. Speaking specifically in mental health, which is very tied up with cultural aspects when dealing with the disease treatment or prevention or this, what can you share of your strategy for local and global markets?
Yeah, so thank you very much. As you've already said, I'm Craig DeLarge with the Digital Mental Health Project, and right now work for Kasana Health as a marketing director, where we're developing a platform that uses smartphone sensor data to actually track passive behaviors, and in tracking that behavior, forgive my head cold I have today. In tracking those passive behaviors, we actually help people to detect earlier when they may be suffering with what I'll call a poor mental state, depression, anxiety, trauma, even suicidality. Because for better or worse, our phones sometimes know more about us and our healthcare states than we do ourselves. One of the things that, and I should further mention that I'm also currently a graduate candidate at King's College London, working on my master's in public health with a particular specialism in global mental health. And I'm actually working on a thesis now around the application of digital mental health interventions in low to medium income populations. So when we say that, we're talking about nations that are classified by the World Bank as low to medium income, or maybe I should say WHO. But understand that even in high income nations, we have populations in any nation that we could classify as low to medium income. And one of the great challenges that we're faced with in digital health is that we've kind of generated this first generation of solutions that are technology versus patient oriented, right? This is why we see lots of technology getting funded, relatively low adoption because of a lack of usability. The other thing we see is interventions developed for wealthy people like ourselves, but where there's still a significant opportunity for making sure that there's better access and equity and how these solutions are developed and implemented within populations. And I would dare say, as an American who spent some time in Singapore actually running a digital health accelerator for a major pharma company and got to see lots of different healthcare systems in the global south and east of the world. This idea of reverse healthcare innovation, which is where we actually look at appropriate technologies that are working in low to medium income societies and think about how we transfer those appropriate technologies back to poor populations within wealthy countries, is a real opportunity that we've not capitalized on as much as we might, but which we still can. I really like the point that you brought up and that Salvador spoke about around this idea of making sure that we customize the solutions and the interventions that are being developed from what I'll call an ethnocultural standpoint. So I very often speak with founders in other parts of the world who say, I got to get to the United States. And for the points that Salvador brought up, I absolutely appreciate that. But I'm always cautious to reflect to them that while the United States is a nice place to come to, it's extremely complex. And you have to have on your strategy roadmap the consideration that your own home country, where you have relatively high barriers to entry based on your understanding of local practice, local custom, local demographics and psychographics, and dynamics of the healthcare system, sometimes really using your local knowledge and wisdom and contacts to first build where you are and then looking at expanding to like populations within the United States, actually sort of a stealth niche entry into the market can actually work, because the fact is we see a lot of ethnic subpopulations, I'll call them, in the United States that are getting little or no attention from the big companies, and who actually don't trust the big companies. You know, the Teledocs and Headspaces and Able2s of the world that are dominating what I'll call the high income part of the market. But if they got an offering from their home country that really connected them to the local cultural values, and even practitioners, and of course, in the absence of practitioners, we have to focus on communities that they've grown up with, that they trust, that help them with getting better in what I'm going to call a healthcare versus a sick care context. Because I think it's very important to understand that in the United States, we don't really have a healthcare system. We have a sick care system, and then it's left to communities and individuals otherwise to try to figure out health. And this is a major, major opportunity that I think we're overlooking. So I can go on about this for a while. I'm going to stop right there and certainly be open to any follow-up questions that there may be. But again, lots of opportunity in the global marketplace that we're not hearing or reading about in the industry press, but which, as we develop ecosystems of contact and networking, which frankly does exist, I very actively keep networks all over the world within this digital mental health space. Again, lots of opportunity out of view, but certainly available to many people who want to do good work in this space. Thanks for listening.
Well, thank you, Greg. You brought up so many interesting ideas and subjects, and I think we should have another session to discuss about middle markets, other markets that people are not seeing, which is I think it's a key thing. Another thing is how we're going to capitalize in some markets that are not as, maybe people think about the US because of the money that is available over there, so they can try to capitalize their service or their product. But I think there needs to be a lot of thought into this for us to try to come up with different ways and business models that can be healthy for the ecosystem.
A very quick point. So all of us know in business that markets mature. There's a natural maturity point that is going to take place in the West that then is going to cause us to start looking, and we see it already actually in Latin America, in Asia, in Africa, in Middle East, that the digital health and the digital mental health subsegment of the markets are starting to develop and get more investment, right? And so I don't know how many of you are familiar with the famous quote by the Canadian hockey player Wayne Gretzky that we should be skating to where the puck. So I'll use a football analogy. We should be moving on the field to where we believe the soccer ball is going, not to where the soccer ball is. And when we think about internationalization, we have to make sure that, yes, US and Europe are good markets to look at, but let's not lose track of the opportunities that are rapidly emerging in the global east and south of the world. I'll leave it at that.
Well, thank you. Good thoughts. And I think it's maybe we could drop off a session, provoke Fernando for discussing about different markets and how we could be addressing regions and talking about a business model. It's a great topic for us to discuss. Thank you for your thoughts. Now, continuing our round, let's go to Greco, which is Marcelo also. So we have two Marcelos and two Renatas this afternoon with us. Greco, the Green Hub, as it's focused on cannabis solutions, it's certainly a disruptive model, particularly when we look at the Brazilian market and maturity dealing with this new market. We can observe a long journey for regulations in Brazil. We talked a little bit before that Brazil has been trying to be aligned with other countries, but we still have a big journey. But some other countries that the topic on cannabis has been more mature and developed, as we could say. Do you see an opportunity for local startups to develop solutions in Brazil, but take advantage of other markets for its operation? Are the opportunities and challenges, in your view, that we could take advantage of this, let's say, green field maybe in Brazil?
Yeah, thanks for being here. So I'm Marcelo Greco. I'm co-founder and CMO for the Green Hub. We are an example of that. We're an accelerator, but we are a startup. We saw a big pain back in 2016 when we started. If we compare the markets, I think we're far behind from other markets when we look at cannabis as all the opportunities. We have many opportunities other than just medical. We have industrial, we have health, we have agriculture. But when we talk about health and when we talk about medicinal purposes, I think we're doing a pretty good job here in Brazil. I'm gonna tell a story how we started. And so back in 2015, when the U.S. was launching CBD as a gold rush, it was a green rush that we called. So everybody was taking CBD for everything. It was CBD for sleeping, CBD for anxiety and everything. A group of mothers found out about CBD here in Brazil in the doctor's office, and they were bringing CBD in their bags and saying, "Oh, this is treating my kid's seizures." So he had 80 seizures a week, and now he has 2 or no seizures anymore. So look at the parallels. The same exact product that we're putting into drops in orange juices in the U.S. Before people were going to academies, was stopping really Dravet seizures, really high seizures for kids here in Brazil. So we saw that pain and we needed to, how can we help that? So what happens is, once the mothers started trying that, they wanted more. And when they tried to get it more, the products were getting stuck at customs here. So, so you have your kids, curing from, not curing, but, relieving the seizures. And then a week after, you don't get your product in your house and the seizures come back. And that's a big problem. So those mothers started fighting in our local, in Anvisa, our local FDA here, to get access to CBD in order to stop those seizures. And we saw that. So how can we help without touching the plant or without, having to work with products? We can start talking to Anvisa and to stakeholders around Brazil. What's cannabis and what can it really do? And how can we provide health and provide opportunities and provide a supply chain that's going to help a lot of people. It's going to help the countries, and how can we do that? So a way of doing that was focusing in technology, innovation, data, and bringing a lot of information, so we could help the process of making people understand, what good cannabis was and what good CBD was made of. And that really works. So we don't have any time to tell the whole story. But if we look at Anvisa did a great job. Now any Brazilian citizen can have access to CBD and good quality CBD, because when Anvisa pulled the bar, and people saw that we had, they had 220 million people of opportunities, they started making their products better. So now we have, today we have 15 products in the drugstores and over 160 companies that import CBD products, mainly CBD products, to Brazil. So what happens is that now after COVID, the U.S. saw that cannabis was an essential product. They tried to close down the dispensaries and didn't close the dispensaries, were treated like drugstores. And they saw here in the United States, we're looking into a recreational adult use. We don't look as much, with doctors and scientists with cannabis. And when they saw that COVID was essential and it was good, they started, bringing doctors and scientists to the table again. In looking into Brazil is going that way. So you see a lot of big pharma interested in going into cannabis. Now we have 2 RDCs and Anvisa, one that you can find products in the drugstores, another one that you can import. The access is much better. You only need a simple prescription. You don't need to go to a neurologist and prove that you needed other treatments like before. So Brazil in this internalization is being a model when you look into medical cannabis. Not even American mothers are having access to medical cannabis as Brazilian mothers are having. It's still expensive. It's still not that democratic yet. You don't have that many doctors still. You need to bring a lot of education still to make doctors prescribe. You need to understand how to treat people with cannabis. Not easy. Cannabis, for all of us, it's individual. It's integrative medicine. It's hard. You don't just prescribe and leave it at that. You need to follow up with the patient in order to see if you're getting results. You have to mix it with the way with mindfulness. You have to treat it with it's a global thing with food that you eat. If you want to stop people from shaking when they have Parkinson, an example, it can make it better with cannabis. But if you don't follow up with the food they eat, if the patient is taking, example, a lot of protein, he will never stop shaking. So you need a lot of follow up. You need another innovation. You need to look into bring more scientists and doctors to the table. But it got much better. Brazil today is an example for that. In the last year, we have more than 110% new patients taking cannabis. So we see a lot of people, wanting to know how to be treated with that. There's a lot of challenges, a lot of regulatory challenges still. But we're growing and we're being a global example for cannabis today.
Well, thank you. Yeah, well, it's really a new path, a new journey for everyone. And I mean, unfortunately, it's not democratic yet. It's not available for everyone. And as you said, a great educational process and regulations and a really great journey. But you said about Brazil, I'm gonna try to come back to the second question and go from you back to the people, because we only have maybe 20 more minutes. But going back to a follow-up question would be with your last question for the session. How far do you think that Brazil is far from taking really advantage of all the market for cannabis?
That's a really, really good question. So cannabis in Brazil is complicated because we have a so-called Portaria 344 from Visa that imprisons cannabis, any type of cannabis, with or without THC in the same basket. So, if you talk about hemp seeds, it's cannabis. If you talk about THC, it's cannabis, sativa. So everything is in the same basket. So that makes everything really, really hard for us to do business. An example, if we could approve hemp seeds, which is only protein, doesn't even have any cannabinoids or anything, it's pure protein, and it's really good for your health. You can make a lot of infusions in drinks and in cosmetics and everything. The simple effect of making hemp seeds legal in Brazil would create a big market for us, creating a lot of jobs and a lot of opportunities. But we can't do that because it's treated like it has THC. Now, even though I'm not talking bad about THC, if it really used well, it's an excellent cannabinoid as well. But simple movements as understanding cannabis as different plants. You have a hemp plant. Though all of the CBD products that we're talking, 90% of products that already come to Brazil are from hemp. They're not even from marijuana. What we call maconha here. It's from hemp, cânhamo. So, the simple fact that Anvisa needs to understand how to regulate that, it's really important, because then we have a lot of ways that we can follow the market. We can do, biodiesel, biofuels, we can do plastic, we can do flooring, wood flooring, we can do fibers, we can do clothing. We can focus on health and on healthy products, with hemp seeds, with cosmetics. We can go into pharma like we're doing in Brazil. We can grow it in plant it in Brazil because we have a lot of land to do that. So it's going to be billions and billions of dollars of opportunities. But since we're a country where we choose to remain blind with that and understand the different the different applications. Fortunately, we're doing well in the pharma section, but it's not enough to put us on the map and make us really a place where we can make money with that still. So what we do in the Green Hub sometimes, we're sending startups away. We're sending startups to Canada. We're sending startups to Uruguay, to US, because in Brazil we didn't give up, because Brazil, it's a big opportunity, and we're being patient about it, and we know that something's going to happen. I wrote over 80 articles in the last 2 years about it, and I'm really trying to help to make things happen. But while it doesn't happen, we can work. We need to work in other countries. But we're far from being on the map when we talk about opportunities and money. But when we talk about science and medical and pharma, we're doing a really good job.
Well, thank you, Greco, for your effort in bringing the benefits so the patient can really benefit from this treatment that we know that is very effective, and hopefully Brazil will be on the right journey in this project. Getting now a advantage of a comment that Greg just did. We must support all treatment with the 5 pillars of diet, sleep, movement, relationships, and relaxation. This is a healthcare beyond sick care. Well, thank you, Greg, for that comment. And combining with your comment and with your second and last question, in a broader spectrum of health, really healthcare and prevention and taking a broader spectrum, how you see or envision digital health with this new clinical outcomes and rethinking the healthcare?
Oh, yeah, this is a good one. So I envision a future, and understand that I'm speaking from the perspective of being a mental health caregiver, which is what got me into this space, the role of being a caregiver, right? I envision a future where there is a level of digital health literacy in our society that our children and grandchildren understand that their smartphones are supportive of their resilience and health and their wellness as readily as today they know that a smartphone helps them to work better, communicate better, and shop better. And it's just as powerful, right, as a tool. But what it is that we're using the tool to break the window of our health rather than building the house of our health. And so I think that, again, we've got a great opportunity. I think it's a generational opportunity. I don't think most of us will get there. That's why I talk about our children and our grandchildren. Um, and I think we can see already, we can see historic instances of how technologies that we used to think were, that'll never happen, like online banking. Now, no one would bank, at least not in the US, without going online. Well, I think we're going to get to the same place with digital health. We just have to be careful that as we go down this path, that we pay attention to the what I call the ethical elements of safety, efficacy, security, usability, and access. So that when we get to this future, it is a future that is benefiting a majority of us, not just a wealthy minority of us. But you can see the trends all over, that by fits and starts, we're on our way. Um, and once again, I talk a lot about this assets issue, but the fact is, though you don't hear about it so much in the press, at least not here in the US, there is an emerging trend around rural health, um, as well as in the US, we call it Medicaid, Medicare. But again, that would be the healthcare provision that's provided by the government to less wealthy populations. And I know people get tired of me hearing about that, but I think once again that if we don't take care of that aspect of this trend, we will be ethically at fault. And I think that we will also have hurt ourselves. For those of us that say, well, we need to be profitable, we will also be less profitable than we need to be. There's a way of doing this both ways. When we look at organizations that focus on ethical management, social, financial, and environmental, we can do this in digital health, but only if we do it consciously and deliberately. Thank you.
Oh, thank you. Yes, that's for sure. Digital could also have a very, very big role in the democratic of health and access. And I think there's some journey for us to discuss about how we're going to refund this in some way, because we have to do it, because everyone needs to be paid, scientists need to be studying, and people need to be developing products. So
Yeah.
capital needs to be brought into place, but how to solve this equation is going to be a challenge for the future. And I think
the other thing I'll say quickly, we're never going to have enough doctors and professionals to treat all of us, so that the future has to also include communities being literate enough to help and treat themselves. Thank you.
Thank you. Well, now with Renata from Sleep Up, going back to the challenges that we have been talking, as we know that there are so many health challenges around the world. Innovation is part of the solution, but as already discussed in this session, there always a cultural barrier, and it's not easy to challenge the many ways the status quo of how things are doing have been done in the past years. And people, well, we have to think out of the box. And do you think that internationalization could be a good strategy for strengthen local markets for the education process? Like Greco said, some countries we have more developed paths in some markets are not, and in the innovation solutions. What are your thoughts on that?
Yeah, well, the cultural aspect, as Craig said, is very, very important. The digital literacy, and there are so many things that we have to consider. For instance, at Sleep Up, we consider and we study a lot user experience, usability. So now the entry version, the free version of the app is available worldwide, and we test and we understand and we try to understand the differences between culture, between how people use it and what features they like most. So the paid plans are not available because of the regulatory approval, but the entry version is the free version is we use for that type of differences. And we are, for example, the Insomnia Severity Index is an index that was developed in America, and we are developing our own in Brazil. So we are developing our own Insomnia Severity Index for the Brazilian population, and that's going to be the first of its own, because everywhere in the world people just use one or two types. And that's the same, and that's what we're doing with the therapy itself, understanding what are the main differences between the cultures. Cognitive behavioral therapy is the same. It's the same everywhere. So how can we make it more engaging? How can we increase the adoption? How can we make it more effective in Latin America, in Latin culture populations? So we consider that a lot, and it's a challenge. It's a challenge, definitely. It's a challenge, and it's not a one-fits-all solution. We have to make it. We have to make it, customize it, and personalize it. And we try to do that. We work in several ways to do that. Our digital therapy consider the anamnesis clinical questionnaire. So we consider a biometric data. We capture biometric data, and we're developing our electroencephalogram headband. So based on that, we based on input, biometric data, usability, we try to make it as more personalized as possible. And we do, because of our purpose, we do intend to go to the public sector. So we, for instance, in Brazil, we have some projects and pilots at the moment in the Hospital das Clínicas. And we know we have to work a lot on our product to make it accessible. Well, a huge amount of people in Brazil don't know even how to read. So we have plans to make it accessible for the healthcare system. And our dream is that, like in England, that sleep is a matter of primary care. In Brazil, it has to be a matter of primary care. So we work a lot on that, and we integrate strategies, and we provide a full journey. So for instance, polysomnography is very expensive. It's very expensive in Brazil, and people don't. It's almost impossible to do it in the public system. We have to wait years. So we bring technologies that are portable and that you can do at home and at home care. So we are bringing technologies as a hub to make the full journey of sleep disorder as accessible as possible, the most accessible and democratic as possible. So yeah, these are the ways that we think about personalization, accessibility, and cultural differences.
But then you believe that even though we have so many different cultural differences, that this internationalization process of startups, of companies, digital companies like yours, could leverage cultural experiences, like you said, England as a primary care and the sleeping disorder, or indexes like in the US being brought to Brazil, that startups or digital solutions could be a bridge for helping that cultural barriers to broaden solutions for the main population? Do you think so?
Yes. Well, the world's global, so we have Brazilian population living in every single world, in every single country. The world is global. Everything is global. So if we adjust, we personalize our product for Latin culture countries, we need to be able to have that regulatory approval, and it needs to be ready for Europe. It needs to be ready for LATAM, for instance. For going to Mexico, for instance, I need if I have American FDA, it's much better. So it's very hard. It's very hard when you think about digital health. Don't think globally. I think we have to understand the differences, the cultural differences, the regulatory differences. But mainly when you talk to consumer digital health, the app stores, they are available worldwide. So it's yeah, I see a lot of challenges, definitely, mainly in the go-to-market by business to business. Is a huge challenge, of course, in terms of startup allocation of efforts and resources. We have to focus on one market. We have to focus in our go-to-market. But when you talk about consumer digital health, it's very hard for me. I think not think globally. I have, for instance, I have people from US asking me, can you make it available, the paid version? I want to use it. I have a lot of people from Portugal using SleepUp. I don't even do any promotion. I don't do anything in Portugal, and I have a lot of people trying to use it. So it's the app stores it's highly accessible. Everyone can get any type of product from the app stores.
Oh yeah, but that's another challenge about engaging patient in its own treatment, and and trying to. But this is another big topic, hot topic that we really need to also provoke, because patient engagement and how I think that could be also a good solution, because but we know how B2C in the medical field, it's difficult. There's some regulations we have to understand the tipping points of this. But thank you, Renata, for your thoughts. Let's try to get the last questions before we have to end up here, and let's go back to Salvador in California. Well, Salvador, considering your academic and entrepreneur experience in both countries, right, Brazil, and now learning in the US, as you've been challenging with all the problems and challenges and obstacles, but also the opportunities in the market. How do you see the evolution of one of the themes that you talk is patient safety, but there's a lot of talk about bringing the patient into the center of treatment, and as an important topic. How you see the evolution of that in both markets, in your opinion?
That's a great topic. Thanks, Marcelo. So, guys, we have a few buzzwords in the market now. So, like innovation, digital transformation, patient safety, and I took some notes here. Patient experience, patient-centered care. So everybody wants to do that. I don't know if you guys know, but have you been to a hospital or a health insurance company that are not talking about this? Oh, we have a program here, and we're doing all, we are reviewing our process. We're all patient-centered care. Well, I don't want to say the word that express my thought about it, so you can imagine the word that really express what I think about it. So I think this will take some time, actually. I think maybe it was Craig just mentioned that there's a generational shift, and maybe our grandsons and maybe their sons. Well, how I see that, Marcelo, I believe that the digital platforms will allow us to give these buzzwords a real meaning. So in our company, we're trying to, our mission is to listen to patients to transform healthcare. We're not listening to our patients. And as our sick care, not healthcare, our sick care industry, it's all based on physicians, nurse, and administrators' wish and needs. So, this patient-centered care is like a flyer on the wall. It's just, I know we have some organizations doing great stuff like, Cleveland Clinic, Mayo Clinic. In Brazil, we have some too. but this is not, I would say this is less than 5% of the whole institution. So it's going to take some time. And I really believe that, the digital platforms will be the tool to give patients a voice. And then we can review our process and really put patient in center of the process. So that's my feeling. I don't know if you guys agree with that, but that's how I see the market.
Yeah, I hope that helps. That really happens, because we always talking about patient empowerment, which is another buzzword.
Another buzzword, yes, patient
That's going around.
empowerment.
I agree with you, but we're going to learn from all those buzzwords and try to make things better. As one of the basic needs is healthcare, as food in the world, right? So thank you, Salvador, for your
Absolutely.
thoughts. And going back now to the legal stuff with Renata. We
Hi.
have just a couple more minutes before we have. I would like to go to you, and the last question with Ana Carolina in Switzerland. So, what's your advice in the legal part for startups, HealthTechs, who would like to pursue the internationalization as their roadmap? What they really need to pay attention when dreaming or putting that in their strategy?
Thank you, Marcelo. I think that the advice I would give is don't make any assumptions. So don't make the assumption of thinking that, whether in Brazil things are done in a certain way, in other countries things are going to be similar, because countries, working with a lot of cross nation matters these days, we see how creative people can get in creating, regulations for health services and health products. So I would not assume that things are similar in Brazil, in the US, or any other country for that matter, because we all have, our own authorities, our own realities, our cultural differences that were mentioned here. So the advice that I would give is, seek someone or build a team that is going to be able to find out what are the specifications that are going to have to be addressed to, adapt your product, adapt your service, make sure that, the go-to-market is going to run as smooth as possible to hopefully be a successful entrepreneurship. So I think that that's my take.
Thank you, Renata. Well, and now let's go for the last question from Switzerland, right? With your experience, your excitement with this process of international bringing your family company to the world with this strategy, and what would you be your advice or the challenges and obstacles that you oversee for a global market, especially in the field that you really know it's in the medical devices?
So I will start with the challenges. I think when we're talking about challenge in our field, for sure, and not just, it's not privilege of our field, medical device, I would say regulatory aspects. It's becoming more and more stern hard to have our products certified. I'm talking about CE mark, FDA, but also in Brazil for Anvisa. I had the opportunity to follow all the steps since the beginning of Anvisa until today. So Greco told a lot about his business also relating Anvisa. And for us at medical device, the same thing. So, and what I'm talking about, bureaucracy, especially to control, to collect, and also to manage the data of patients, the data of our products, and how we can monitorize then to do the traceability, for example, how to monitorize then the market, but also clinical trials. Medical devices used to be in the past one field where you could do copy and paste products, as I think Salvatore told about it. But nowadays it's any more reality. We cannot do it anymore. So it's more and more complicated. And at the same time, which is a challenge, the price are decreasing. You know, we have big companies producing massive volumes, India, China. Oh, I have a list of countries where you can find products and they are supplying the market with really, really low price. So I would love to say, you know, innovation for, or even to bring some good aspects, competitive advantage would be the opportunities where they are not anymore. You know, innovation for medical device are the only thing you can do to survive. We are more and more looking to solve some problems of our patients. We are more and more making the surgeries faster to reduce the cost of the hospitals, to bring some more, not the advantage of our product, but how we can affect, you know, the hospital and all the health system. And in my opinion, the opportunity, and it's really where we are guiding our company, I think was Renata from SleepUp told us about, is customization. I think this will be the future of health medical devices. The patient want to have the best solution of their problems. So when we are really talk to bring them back, in our case, the movement, the, you know, the life quality, the quality of their life, and not just to have a product on our shelf and deliver for the patient. So we are doing more and more customized implants using, for example, additive manufacturing, looking for also this kind of new technology, manufacturing technology, to make the cost decrease and to bring new possibilities, to bring, you know, to create innovative products, but innovation which really the patient can feel. It's not marketing innovation. I think this is something, in my opinion, is not opportunity. It's just things that the companies are doing to survive in this market.
Well, thank you. Well, it's been a pleasure. We've reached the end. I think we still have 1 or 2 minutes at the most. So I'd like to really thank you all for the wonderful thoughts. I think was very delightful, for at least for me, and I'm sure for all the listeners who are with us. And I hope we can see each other again. And borrowing from the Economic Forum, as they say, the history at a turning point time, I think we kind of covered here a little bit of health, digital health and solutions at a turning point time in history that I think we really have a greater opportunity to, as some of you covered, bring access to health for the global community. Thank you so much. And I'm not sure if Sembranet is here, and if you want to give the last words, Fernando. Thank you so much, and thank you all the guests. And I hope I did my homework well. Thank you.
So thanks so much, everyone. I think this is the first panel. Are you hearing me, Craig?
Yes.
Yes, we are.
So thanks so much, everyone. I think this was an amazing panel. So much different topics, different experience. I am very glad that we did this. And I know that for us that speak Portuguese, it's a little bit challenging to make a panel in English, a little bit uncomfortable, but I think this is important. Certainly what we want to do here is to be part of this global world, so people abroad to understand it, and especially to connect with us and do business. I especially thank Marcelo and Sim for the moderation and for the speakers, Craig, Renata Rothbard, Renata Bonaldo, Salvador Gulo Neto, Ana Carolina Brito, and Marcelo Pereira. Thank you. So, and now we are going to take a final picture. Please smile. Thanks, everyone. See you soon. Bye-bye.
Bye, guys.
Bye-bye. Thank you.
Everyone, bye-bye.
Bye, it was a pleasure. Bye.
Próximo painel às 15, daqui a 15 horas. Obrigado. Muito obrigado. Nada.
o painel dos pitches.
Às 16h30.
Todo mundo vai estar online?